Hello everyone, it's Adam here from Alto Hearing. We are an independent audiology clinic based in Kenilworth and Lutterworth UK, and I'm back today to bring you another earwax removal video. This time it's from our relatively new clinic in Kenilworth, Warwickshire. If you do enjoy watching these videos, if you wouldn't mind taking a moment to subscribe to our channel, we would really appreciate it, and it does make a big difference, so thank you. Now, we've had a bit of a break from posting regular content on here recently, and that's just been down to the fact that it's been so busy with opening up this new practice, and then it's been summer, so a few holidays here and there required. But we're back, and I've got a couple of different earwax procedures for you today. Now, the footage that you see here on the right has been recorded using something called a video endoscope. This is a very thin metal rod with a fibre optic light source and a camera. We're able to use these to get an excellent view of the ear canal. So our endoscope here is attached to an iPhone, and it produces the video image you see here, which the clinician views on the iPhone whilst doing the procedure. And we also have it broadcast to a television on the wall in the clinic room, so the patient is able to see exactly what's going on. They don't always want this turned on, but actually we find for those who do, it helps keep them relaxed, knowing what's happening. People do seem to quite like it. The clinician performing these procedures today is Andrew Holmes. Andrew is a trainee audiologist, currently studying at the University of De Montfort in Leicester. We are very fortunate here to be able to accommodate apprenticeships at Alto, and Andrew is an absolutely fantastic addition to our team here and is being expertly mentored by our team of clinicians. Andrew's fully trained up in earwax removal. Funnily enough, he was trained by the one and only Mr. Connor Borland from Durham Hearing Specialists, alongside Lily Todd and Mr. Banerjee. They run an excellent training course, and Connor, as you probably know, is an absolute brain box and delivers a really first-class program, and we've seen the results of that with Andrew, who has very much benefited from the support they've provided. Which is interesting, as we're actually going to be hosting Connor and team at our Kenilworth clinic in October, and we're going to be running a training event from our clinic, which is very exciting. So Connor will be down here, and I do believe a certain nurse, Richard, is also making his way down here to attend, which is going to be fun to see them both. So there's a lot going on at the moment. By the way, I apologise if you're the sort of person who'd like me to give a frame-by-frame commentary on these wax removal videos. I do realise we're now a few minutes in, and I haven't really spoken about what's there on the screen, but I found it's quite hard to sit here every video without repeating myself too much. But what I will say is, in these couple of videos today, we've got some really stubborn, tricky ones. The thing about earwax removal is you look inside an ear and you think that it will come out really easily, and then the opposite is the case. It looks like you should be able to stick the Zollner in, which is the suction tube, grab onto the wax and just pull it out. Sometimes that's the case, but more often than not, it just isn't. Earwax needs nurturing and takes quite a lot of patience. I think that's probably the hardest thing to learn when doing this. It's quite easy to get frustrated. You have to very gently, bit by bit, move and segregate the wax from the ear canal. The ear canal is not it's not a natural cylinder. It has bends, so you're trying to move the earwax around these bends at the same time as trying to detach the dried earwax from the walls of the ear canal. It's tricky, especially in cases like this when you can see good movement but it's just not budging. We use a combination of different tools, the microsuction being the main one, but we will use hooks, Jobson horns, which are like little spoons, forceps, all with the aim of gradually moving it along until we can get it out of there. Sometimes we use irrigation. We've got a few different types of irrigation as well. This is when you use water that is heated up to body temperature to wash out the earwax. This can be very effective as well. Which method we use will generally be down to how the person presents, the consistency of the earwax, and then their medical history. If they've got perforations or a history of infections or vestibular issues, then we'll steer clear of irrigation and instead focus on microsuction and manual removal. It really isn't nice being bunged up with earwax like this. We've spoken in other videos about what can happen as a result of earwax. It can cause you to feel blocked up, but in some cases it leads to hearing loss, tinnitus, and even quite severe pain in the ears. So when you're able to help someone out like this, it really does bring us a lot of satisfaction to see how happy people are once we've been able to sort them out. Anyway, so in this second one, you can see we're dealing with a fair amount of hair in the ear. Hairy ears are actually quite common. It's something we deal with a lot, and it can make life a little bit difficult as the hairs tend to mix in with the wax and just make it quite hard to retrieve. You've just got to work around it. Sometimes you can cut them away a little bit, or what we've done in this case is applied some sodium bicarbonate just to help lift the waxer. Once again though, it comes down to patience. This process takes time, and it's just making sure the patient is comfortable and bit by bit manoeuvring that wax out of the ear. An appointment can take quite a long time. For us, we try and keep to a maximum of 15 minutes per ear. Often it's a lot less than that, but if it starts getting to the 15-minute mark, it can start getting a bit uncomfortable. Sometimes we'll rebook, but it depends on how the patient is feeling. Now, I know we've talked a lot about the process of removing earwax, but I think it's worth mentioning a bit about prevention as well. While we can't stop our ears from producing wax, and we wouldn't want to, as it serves an important purpose, there are things we can do to help manage it. Firstly, it's important to remember that our ears are self-cleaning organs. In most cases, they don't need any intervention from us. The natural movement of our jaw when we talk and chew actually helps to move old wax out of the ear canal. However, some people do produce more wax than others, and that's where we come in. One thing I often get asked about is ear candles. I have to say, we really don't recommend these. There's no scientific evidence that they work, and they can actually be quite dangerous. The same goes for cotton buds or Q-tips. I know it's tempting to try and clean your ears with these, but you're actually more likely to push the wax further in and potentially damage your eardrum. Check out our video here of someone who was using ear candles if you do need some proof that these things are actually quite dangerous. If you're prone to wax buildup, there are some over-the-counter drops you can use to help soften the wax. These usually contain ingredients like olive oil or sodium bicarbonate. They work by softening the wax, making it easier for it to come out naturally. But if you're using these and are still having issues, that's where it's time to come and see a professional like us. Before I wrap up, I just want to remind everyone that if you're having any issues with your ears, whether it's hearing loss, tinnitus, or just a feeling of fullness, don't hesitate to get it checked out. It might be something as simple as wax buildup, or it could be a sign of something else that needs attention. Either way, it's always better to get it looked at sooner rather than later. And that about wraps it up for today's video. As always, if you found this helpful, please do give us a like and subscribe to the channel. We've got plenty more content coming your way. Until next time, take care of those ears, and we'll see you soon.